Hello, and thank you for joining today's webinar. Really excited to dive into this month's topic because, as we know, there's so many marketing tools and software platforms and technology out there. So it can be really hard to determine what exactly is necessary for your practice. So we'll recommend some tech and marketing tools here that will position your practice for success moving forward, especially in an era where patients are becoming more tech savvy and demanding than ever. So definitely we want to help you keep up and maintain that growth. So let's get started. My name is Pauline Ith, and I'll be your host for today's webinar. I'm an account manager here at GMR Web Team, where we combine the latest technology with custom marketing solutions to help practices acquire more patients and increase retention. So here's what we'll be discussing for today's webinar. First, I want to dive into the healthcare landscape and current trends. And then we'll talk about exactly what these changes mean for your practice. By learning more about what's shaping patient behavior and healthcare landscape growth right now, you'll understand the value that marketing tools and technology can bring to your practice. And then we'll talk about exactly what marketing tools and tech that you need to succeed. And of course, we'll have a Q&A session at the end. So please leave any of your questions in the Q&A box and I'll get to them at the end of the presentation. So what is the current healthcare landscape? The healthcare industry has evolved a lot over the years. In fact, more and more doctors are realizing that marketing is definitely necessary to be competitive. And this is due in part to the impact of healthcare consumerization and a few other trends, right? So let's first talk about healthcare consumerism. So with healthcare, it's definitely becoming a lot more consumerized, aka it's being treated more as a service, think restaurant, e-commerce, hotels. This means patients are becoming a lot more selective and want their care to be tailored to them and expect a really high level of service. I find that healthcare is one of the last industries to be touched by this. Healthcare practices are now, they need to pay attention to patient behavior more than ever, changing patient demands. Meeting this is definitely how you can grow and adapt in a world that's changing more rapidly. So let's look at the factors that are driving healthcare consumerism. So first, higher deductibles and higher costs has definitely been a big effect. Patients are absorbing more of their healthcare costs, which is causing them to reevaluate where they're spending their money for healthcare. So it means they become pickier with who gets their hard-earned money. Second thing is that patients have more options and access to information than ever before. The internet has given patients the opportunity to learn more about different treatment options, diagnoses, and explore, all the providers in their local area and even beyond that, right? So they're not limited to what's in their neighborhood at the moment. In addition to that, a lot of non-traditional companies are now entering the healthcare space and looking to meet and fulfill needs in the space. So for example, Walmart and CVS are trying to fulfill primary care roles and having NPs and some MDs staff, some of their minute clinics, and other companies are using telemedicine and technology to provide care directly to consumers, whether that's mental health care, maybe contraception options, primary care via telemedicine. So there's a lot of more competition and companies kind of looking at healthcare from definitely a more business aspect than just a patient care aspect. So that's definitely driving consumerism. In addition to the consumerism trend, patients are definitely looking at a lot more online reviews than ever before. So that's a really big trend now. One study found that 81% of patients look at online reviews before selecting a healthcare provider. And that number has definitely grown over the years. When I first started at GMR Web Team, a few years ago, the idea of online reviews was still very new to a lot of healthcare practices, but now people are definitely prioritizing that more than ever. They are still looking at your credentials, experience, and whether you're in network with their insurance. But like we mentioned, reviews are becoming more important. It's actually the third most crucial driver in the selection process. So that's why reviews are a big focus with a lot of practices' marketing strategies. And again, this kind of attributes to the consumerism, right? So consumers are trying to treat healthcare more like a restaurant or product. They want to know about the experience before they go. So physicians and practices must have better reviews to meet this new expectation in order to increase acquisition. So that's critical. Another trend is that private practices are actually shrinking. There has been more consolidation of privately owned practices, and newer doctors are choosing to be hospitalists or work at very large healthcare orgs instead of starting their own practice. And the American Medical Association found that in 2020, this was the first time private practices ownership has actually dropped below 15%, 50%. It's becoming a lot harder for practices to compete, especially practices who aren't as tech savvy. So if you are an owner, and you independently own a practice, you definitely want to have the right tools and technology to meet new patient behavior and to be more competitive against all these larger hospital orgs or some of these newer tech companies that are coming into the healthcare space, right? So that's one of the key factors here. And now let's talk about COVID-19. That's definitely shaped everyone's lives and especially the healthcare industry. So because of COVID-19, a lot of patients are, taking more charge of their health. They're being empowered to make more decisions and be involved with decision making. And they're also more willing to disagree with providers. You've seen the various opinions that people have about COVID-19 vaccinations, what treatment options there are for that. It's only grown more since the availability of the internet, right? Because there are other professional opinions out there online. So they don't have to always rely on the provider. In addition to that, COVID-19 has also increased the popularity of telemedicine, especially with patients who lead busy lifestyles, don't feel like they need to come into the office just for a simple follow-up visit. So that's something that's definitely become in the forefront of COVID-19. Telemedicine was there before, but definitely not as popular. So we went over a lot of trends. So what does this exactly mean for you? First, because of healthcare consumerization, because patients are more careful with spending their money, your patient experience will definitely affect your retention rates. Again, people are becoming more selective. They're not going to tolerate a bad experience or if they feel, not being heard. So that's a big factor. In addition to that, you can see evolving trends. Practices are shrinking. Private practices are shrinking. There's more of importance on online reviews. So your marketing strategy should evolve accordingly to the healthcare landscape and what patients are expecting, right? And of course, technology can help meet the demands of patients, right? Think about already telemedicine trying to meet that demand. So there's more technology and tools available than before, so you should definitely be leveraging, right? So that's how we're all connecting the dots here. So let's talk about exactly the marketing tools and technology that every provider needs, right? So some of the stuff is more marketing focused and some of it is just general technology. So we're going to dive into each of these and see exactly how it can address that rise of healthcare consumerism and all the trends we just discussed. So one of the best things I think a practice can do, especially if they're independently owned, is really take advantage of more automation. This results in less work for your staff and increased patient satisfaction. So what does this entail? Online scheduling is something that I really encourage every practice to have. I've seen some older practices don't even have, ability for someone to call or even fill out a form. So having an online scheduling tool can really change the game for you. Many patients, especially Gen Xers, millennials, they really like to have the option of booking appointments online for the care they need when they need it. So having an online scheduling system can help convert actual website visitors into appointments. So that's why I think this piece is so critical for every practice to have. Following up on that is automated appointment reminders and confirmations. So this is a great way to help reduce no-shows and reduce the workload of your staff, right? So I've seen so many practices still to this day call to remind patients to make it to their appointment, but that takes away from, the staff's time in office doing other important tasks. So when you can automate this feature, whether that's through your EMR or through another platform, it's so critical to help reduce those no-shows and make sure people get in for their appointments. In addition to that, text and email broadcast tools are one of my favorites. It's such a great way to share more information about your services, your offers, any reminders for health screenings and exams to patients. So recently, one of my clients, she's opened up a lot more availability on Mondays and Fridays for, hygiene cleanings and restorative dental care. So having text and email broadcasting available for us to quickly send out a note to all her patients really helps, again, get those appointments in, and really shows patients like, hey, we're always here for you. We're ready to engage. We have easy means of you contacting us. So that's why I love text and email broadcasting. Definitely a tool that every practice needs in their arsenal. And then more automated emails. So recalls are one part of it. Recalls, I think, are a great way to get people in for exams they are due for, whether that's dental exams or annual physicals. I personally get a postcard from one of my dentists, but I think it's so great if she can send it via email or text, right? Because we're always on our phones. It's a great way to, again, to engage, especially with those younger audiences who are younger patients that, want a digital avenue to be able to book appointments. And just that, holiday and birthday e-cards, another great way to increase patient engagement. Again, with our GMR platform, it's all automated. According to the patient data, we can send out automatic birthday cards and holiday e-cards, and it's a great way, again, to provide that level of customization. Patients want to feel unique and catered to, right? So they like that personalized experience. So that's the birthday and holiday e-cards, and the recalls are part of that. Okay, so let's talk about automated patient referral programs. I think these are very underrated and definitely not talked about enough. Again, referrals are still a great way to grow your practice because of the few costs associated with it, because you are leveraging your current patient base, right? And what better ways to get referrals is to automate the programs, because it allows you to consistently ask your most loyal patients to recommend you to others. Our system is able to identify who your happy patients are, send out an email to ask them to refer the practice out to friends and family. Again, you can always verbally ask, but things get busy at the practice. So having this automated process really just makes everything a lot more efficient. And I love the system. And any good patient referral program that's automated should be able to track who referred you out and who actually requested an appointment, right? So you can see, again, from the email, who's opened it, who's clicked, who's actually sent out your practice to someone who might need it. So I love that it's very data backed, focused, and automated, right? Less work off your plate. So something definitely I think every practice should have moving forward, because it's definitely technology that's available. So thinking about the healthcare consumerism, how experience is so important. Automated patient satisfaction surveys are key to monitoring that patient experience. Again, like I said, patients are demanding more and are willing to leave due to a negative experience. So many industries are already implementing surveys to find out how they can improve business, and healthcare practices need to do the same, right? You're a business too. You shouldn't think it's not needed. It's definitely a core piece, right? And I like surveys because they actually provide measurable data. You can do multi-question surveys. You can do a net promoter score, which is what we have here, just one question. But with that, we're able to measure, on a scale of 0 to 10, how satisfied someone is, what are the people commenting about the front desk? Is it easy to make appointments? How is the overall experience? Again, this data can turn into actionable insights for your practice. And I always say, especially if you want to grow, this is so critical, right? Because I find that once practices start to scale, open up more locations, hire more staff, more providers, that's when things start falling through the cracks, because, you're so busy growing that sometimes maybe someone isn't spoken to in the correct way, calls aren't handled properly. So by measuring through surveys, you can combat any attrition and catch problems before they become recurring patterns. And automated surveys can be implemented through your EMR system. A lot of them have it now, or you can do it through another platform like SurveyMonkey. With our clients, we have a platform to send out these surveys along with review requests. So we're pretty all inclusive, and that's why we combine that technology with that custom solution, right? So satisfaction surveys, definitely a key must. And let's talk about online reputation, right? Because we did touch upon in the beginning that online reviews are so critical, right? Because 81% of patients consider that when selecting a healthcare provider. So even if you're putting in a lot of marketing efforts and you have very poor reviews, you're going to have a hard time convincing people to select you over someone else with better reviews, right? So that's why it's so key. to patient acquisition. And I like an online reputation management platform because it creates a standard process for review requests. You get to ask more of your patients to leave reviews. You don't leave it up organically. I often find practice online reviews are typically underrepresented because they don't have a system in place, right? Unhappy patients are really vocal, and then happy patients just forget to leave a review. So when you have a system in place, everyone gets asked, you get the more genuine reviews coming in. And then it also eliminates any hesitancy from your staff to ask for reviews. I get that question a lot, like, hey, my staff doesn't want to ask. Well, if you have a platform sending out texts and emails requesting reviews, then that eliminates that problem, right? It solves that issue. In addition to that, I love that it helps track the amount of new online reviews that are coming in. I have to find practices if they're trying to do it on their own. It's too many sheets, too many emails coming in. So if you have a platform, you can see everything in one place. So that's why I think this is so key. Again, technology is here. You just have to leverage it. And I just want to share a little bit more about our process because we combine satisfaction surveys with online reputation. So after a patient's been checked out, we send them a 1-question survey just asking them, are you likely to recommend us? And based on their score, if they get a negative score, then the practice gets notified. And again, that's that retention satisfaction piece. So we can reach out to anyone who's unhappy and figure out what went wrong. If they rate positively, then we just make it really easy for them to leave a review, right? Especially on the review site, their choice, whether it's Google or Facebook or Healthgrades, it's all custom, right? To exactly what your practice needs. So that's our process. Again, there's other platforms out there, but you just want to make sure you are implementing this because, again, a consistent process results in consistent reviews. Okay, so let's talk about artificial intelligence. So it's already, a very hot topic, buzzword. It's definitely prevalent in the tech industry, especially when it comes to evaluating customer service. And I think that's where it can really benefit healthcare practices. It plays off the whole satisfaction piece, right? So by leveraging AI, you can create more in-depth insights into patient experience, identify common complaints, strengths with little effort, right? So you don't have to sift through the information or all the data. The AI does all the hard work for you. And this is, I can see, very beneficial for people who are multi-location, multi-provider practices. You can just get insights very quickly, right? And again, AI can also break down where providers are exceeding or not meeting expectations, or segment, data by departments, example, providers versus nursing versus front desk, or even by location, right? You have a lot of locations, you want to see who's hitting the mark and who might be missing it. And again, it can also identify specifics such as maybe wait time or service or how helpful the staff is. And this is all from, again, that combination with that patient feedback survey and using AI to get you all the highlights and key points so you can do what's needed to position your practice for success, right? Actionable insights. So I think, AI is one of the most underrated tools here. It's definitely something very new. I know practices aren't too familiar with it, but it's definitely the future of healthcare. Again, patient experience, right? That trend is it's here to stay, having a high level of patient experience, right? So AI can definitely help with that. So telemedicine, we touched upon this briefly earlier. It's already given for a lot of practices due to COVID-19. A lot of people were using it, especially at the height of the pandemic, where in-person visits were often not available. But I've actually seen a lot of practices reduce their usage of telemedicine due to COVID-19 cases just dropping overall compared to when it first started. However, I think it's still a critical piece of technology that practices should still be offering. The convenience of telemedicine, especially for those maybe living in rural areas or patients with extremely busy lifestyles or patients who have to come in with a lot of follow-up visits, I don't think that convenience can be matched elsewhere. So I think telemedicine should still be a key part your offerings. And if you're worried about, hey, I don't know if patients will be satisfied with that, comparison study done by Repugen showed that satisfaction with telemedicine is often on par with in-office visits. So again, comes back to that convenience, patient experience, what patients need, having more visit options for them results in a high level of satisfaction. And again, more opportunities to get more patients for you. So telemedicine is definitely key. Extensive call tracking and analytics. So this is one thing I don't see enough practices leveraging, especially smaller ones, is call tracking. I know a lot of larger orgs use call centers, so that's already set up. But again, smaller practices don't usually have anything. And in a study completed by Google, people found that they found that 56% of people who search for a healthcare provider still want to follow up with a phone call, right? So it means after they check your online reviews, your website, they'll still be likely to pick up a phone to call. So don't you want more data on that? Of course you do, right? So call tracking allows you to learn exactly how calls are being handled. I've seen plenty of times when practices start acquiring more patients or have a new staff member, we usually see a drop in conversions or sometimes extra negative reviews because phone calls aren't being handled properly. So call tracking can record, calls in a HIPAA compliant manner so you can better understand how to meet patient expectations. In addition to that, I love call tracking because you can learn exactly where your new patients are coming from. So many times people complain that Google ads or Facebook ads aren't working, but they usually don't have a proper setup. So having a dedicated number for your online and offline marketing campaigns can help you better measure if your campaigns are working. So the tool we use is CallRail. It's definitely easy, low-cost setup. It allows us to track all the call data we need from our clients, whether that's first-time callers, what's actually being said on the call if needed, and where the calls are coming from, whether it's from online versus in office versus Google ads. So that's why we love. We love call tracking. So definitely a great tool that every practice needs to leverage. Okay, so we covered a lot today, so let's go over some highlights. So first we talked about how some trends in the healthcare landscape right now. So that's how individual healthcare practices are shrinking, facing a lot more challenges when it comes to meeting expectations and acquiring more patients. And then we also talked about healthcare consumerization and how it's shaking up the healthcare industry. It means patients are expecting more from their healthcare experience. They demand a high level of service and they have more options than ever before. And also they have a higher burden with healthcare costs. So that means they won't tolerate bad experiences. They want to be very careful where they spend their money, right? So that's how practitioners can use the latest healthcare tech and marketing tools to better reach out to patients, better meet expectations, better address those pain points that healthcare consumerization has created. So this includes, the marketing automation we talked about, telemedicine, call tracking, patient satisfaction surveys, and that reputation piece, right? So everything works together again to address that consumerization and the changing patient behavior, right? So that's why it's key. So that's the end of our presentation. Let me, see what questions we have here. Okay, so we have one. So if we have to choose one thing out of everything presented today, what would it be? I would say the online reputation piece is really critical because it hits a lot of the points, in terms of like the online reviews, patients looking to learn more about their experience. If you could combine that with the satisfaction surveys, I think that's very much the minimum you should do. Because again, you always want to know what's working and what's not and generate those reviews, right? So I think that's the most critical piece. Let's see. One more question that relates to review generation. So which review site should we prioritize the most? There's a lot out there. Should it be Google? Yeah, I think Google is the most important. It factors a lot into your individual online rankings. And again, Google's grown in popularity. I would say it's definitely the most prevalent. If you search up Doctor Near Me, a lot of those Google reviews will pop up first. So I would say that's the biggest priority, followed by WebMD and Yelp. And I say that because we've done a survey, we've done market research on what review sites people prioritize the most and how people use reviews. So in that survey, we found that Google's number one, with 76% of people checking that, followed by WebMD and Yelp. And of course, it'll depend by specialty, but I would say Google is definitely king. Okay, I think those are all the questions we have for today. So let's see here. So we're always here at GMR to definitely help you grow your healthcare practice. So if you're interested in scheduling a free consultation, definitely visit gmrwebteam.com for more information on that, or give us a call. Again, thank you for your time today. Really appreciate it, and hope you have a great rest of your day.